have you ever smoked cigarettes? No. Have you ever been diagnosed by a healthcare professional with cardiovascular disease, heart attack or myocardial infarction, congestive heart failure, angina, pectoris or chest pain, coronary insufficiency or claudication, pain in the legs with walking? Okay. Have you ever been diagnosed with a heart rhythm problem called atrial fibrillation? Have you ever been diagnosed by a medical professional with a thickened heart muscle or an enlarged heart?
No.
Have you ever been told that you've had a stroke?
No.
And have you ever been told that you've had a mini stroke or TIA?
No.
Are any of your first degree relatives, have they ever had a heart attack before the age of 60?
What's first degree relative?
So it'd be parents, siblings, or children?
No. Not to my knowledge.
And has your mother or father ever had a stroke before the age of 60?
No, not to my knowledge.
And have you ever had any history of head or spine trauma or injury?
No.
Any history of blackouts or loss of consciousness due to drug use, alcohol, or medications?
No.
And have you ever had a history of seizures, convulsions, or fits?
No.
And any history of learning disability?
Attention deficit disorder?
Attention deficit disorder. Did it impair your school performance at all?
Yes, I had to get teaching assistance during high school,
During high school.
and I was on a medication called, Focalin for a time.
And did you graduate high school?
Yes.
And have you ever been seen by a neurologist or given a neurological diagnosis other than the attention deficit disorder?
No, I don't think so.
Okay. And is your ADHD resolved? Are you still taking medications for your ADHD?
Oh, no. I dealt with it in other methods.
And have you ever had syphilis?
No.
And how do you classify your ability to concentrate or maintain attention? Is it as good as it always has been? You have any trouble completing tasks at home, or finding that things take more effort than you normally would think they would?
It's pretty normal for me to keep focus. I don't have any issues. I used to, but not anymore.
And any difficulty understanding things that you're reading or things that you're watching on TV?
No.
Any difficulty with your memory? Having trouble with forgetting things?
I have had some minor memory issues, but I don't think it's more than.
Can you expand on that a little more?
Let's see. After high school, I noticed my memory had been a little bit less reliable. I think I think it was because I was on focusing medication for the attention deficit disorder, and I just noticed that my memory is not as reliable, and I started having to take notes and keep a schedule for myself rather than.
And with doing that,
totally reliable.
And with doing that, you manage okay though.
Yeah, I'm fine.
So how many years do you think that's been going on for?
Probably the last 2 years.
Last 2 years. When do you think it began?
Probably my second semester of my freshman year of college.
2 years ago.
Yeah, so 2 years ago.
Any difficulty with speaking or picking out words?
Describing what way?
Any trouble with finding the right word to use for getting the names of things, common objects?
That's usually or not necessarily for like common objects, but for like adjectives or abstract concepts. I lose train of thought in that conversation occasionally, and I like can't like I often have to like come up with a word that roughly sounds like what it means.
All right. And how long has that been an issue for you?
I think that's been the ever since like I was very young in elementary school. I had issues stuttering, and I think that was the main source of my stuttering as a child. It's always been very mild, but and it only comes up like it was much worse when I was younger. But I think that's more or less the issue behind my stuttering, as opposed to like normal like mouth dexterity and actually speaking.
Okay. Any difficulty with your mood, depression, or being excessively sad?
I don't think more than a normal person would be under my circumstances.
Okay. Any feeling of apathy or being withdrawn from, social situations?
No more than a normal college student.
Any difficulty with your walking or balance? Or as good as it's always been?
As good as it's always been, I suppose, yes.
Right. Any hand coordination difficulty, or is it as it's always been? Any shaky movements of your arms or legs, or jerky movements of your arms or legs that you can't control? Do you feel like you have weakness in muscles in your body, or are they as good as they've always been?
They're as good as they were.
Any pains in your arms or legs, burning pains, aching pains, shooting pains?
No.
Any tingling in your arms or legs? Like a tingling feeling. Any loss of sensation anywhere in your body? You feel numb?
No.
And any difficulty moving one side of the body versus the other? Drooping in your face, double vision?
No. I mean, not any more than being right-handed over left-handed.
Sure. And have you ever had any diagnostic studies done, such as an EMG or a nerve conduction study, which is where they use electrical shocks in the nerves in your arms or legs?
Not for neurological testing, but for what's it called? Physical therapy.
Physical therapy. What did you have done?
I used to have some motor skill issues with my ankles. I used to not necessarily walk straight. However, after like a month or two of physical therapy with electrodes and like walking exercises.
Were they to stimulate your muscles?
Yeah.
Okay. But nothing. Okay.
My Achilles. I think it was a muscular issue instead of a neurological one.
Any difficulty controlling your bladder?
No.
And any difficulty obtaining erections?
No.
Any fevers?
Like in what way? I mean, I get fevers when I'm ill.
How about when you're not ill?
Oh, no. No. I mean, not that I know of. I usually take a fever as a sign of being ill.
Mm-hmm. And any shaking chills? Fatigue?
Not abnormal fatigue.
Okay. Any weight loss?
No.
And any diarrhea?
No.
And how do you feel you're doing at home in terms of being independent and able to do things on your own, like cooking and cleaning and bathing?
Oh, fairly well, yeah.
And you live on your own right now, or when you're in college?
Yes, while I'm in college.
I'm going to ask you a few basic questions now. Can you tell me where you are right now?
In this office.
Do you know what floor this is on?
5th floor, I think.
Do you know the name of the building?
Don't know the name of the specific building. I know where Johns Hopkins.
And what kind of building is Johns Hopkins?
Medical facility.
What is the date today?
The 16th? May 16th?
What day of the week?
Should be Monday.
And what year?
2015?
May the 18th.
18th.
Sorry. And who's the president currently?
Barack Obama.
And I'm going to give you a few words to remember, and I'm going to ask you them a little later.
Okay.
Dog, hat, green, and peach.
Okay.
Can you say those 4 words back to me?